everyone. My name is Ben Nagraki, and I will be presenting my capstone project on hospital-acquired infections and how it relates to hand hygiene compliance. The objective of my capstone project is to raise awareness of the ongoing issue pertaining to healthcare workers not complying with proper hand washing techniques, which initially can lead to hospital-acquired infections, or abbreviated as HAIs. We'll first talk about what HAIs are, types of HAIs, where they are found, and ways to minimize them. We will all be talking about proper hand hygiene techniques and why it is so important to comply with these measures and protocols within our healthcare facilities, the elimination of HAIs, decrease of hospital costs, and even deaths. Some common types of HAIs are catheter-associated urinary tract infections, also called CAUTIs, surgical site infections, also called SSIs, pneumonia, PNA, Clostridium difficile, also called C. diff, invasive methicillin-resistant Staphylococcus aureus, also called MRSA, and central line-associated bloodstream infections, also called CLABSIs. Where our HAIs are found? They are found everywhere. Unfortunately, HAIs are infections that are associated with invasive devices, interventions, or procedures carried out in healthcare facilities, and can be found in areas such as acute care hospitals and ambulatory surgical centers, dialysis facilities, nursing homes, long-term care facilities, and our outpatient care clinics, physician's office, to name a few. And the prevalence of HAIs. According to Maggio et al., who conducted a multi-state point prevalence study of HAIs, 1 in 25 patients in the acute care setting will develop an HAI during their hospital stay. HAIs are important causes of morbidity and mortality in the United States, associated with a substantial increase in healthcare costs each year. Recent studies have suggested that implementing existing prevention practices can lead up to 70% reduction in certain HAIs. In addition, healthcare workers from numerous healthcare settings have expressed that they don't think that proper hand hygiene can significantly decrease HAIs, which is sadly enough, observational studies show that there is only a 25 to 50% compliance rate amongst healthcare settings. Prevention of HAIs. Proper educational programs and training for healthcare workers. Validated and standardized prevention strategies have been shown to reduce HAIs. At least 50% of HAIs could be prevented as a result of proper compliance. Most solutions are very simple and not resource demanding. Example is healthcare costs. Most importantly, proper hand hygiene and compliance. The ins and outs of proper hand hygiene. Hand hygiene is generally poorly adhered to across the board by all levels of healthcare workers. The hands are the most important vehicle of transmission of HAIs in healthcare workers and are usually always their hands. It has been determined in multiple evidence-based research studies that proper hand washing techniques will in fact help minimize HAIs in most healthcare settings. With that said, so why don't healthcare workers comply to proper hand hygiene? A few reasons or lack thereof. Too busy or insufficient timing. Patient needs take priority. Understaffing or overcrowding of healthcare workers. Sinks are inconveniently located or out of order or do not exist at all. Lack of soap, hand sanitizer stations, towels, etc. Hand washing agents can cause irritation or dryness. Therefore, healthcare workers will not use proper hand hygiene in that respect. Low risk of acquiring infections from patients. Poor design structure within their healthcare setting or floor. Lack of education and or outdated policies. In addition to healthcare workers' non-compliance of hand hygiene, another issue that seems to be apparent as well is the patient's inability to practice safe hygiene while in the hospital. Some examples, like if they're incapacitated, have mobility issues, and have newly inserted post-surgical catheters or drains. Again, other examples include out-of-order sinks, no hot water, and empty microbial soap dispensers. Can cause barriers and non-compliance amongst patients as well. Uttermost care should be taken in the following services. This is just to name a few. For example, housekeeping, dietary services, linen and laundry, central sterile supply department, nursing care, waste disposal, antibiotic policies, hygiene and sanitation. What ways can we help change this? Provide easy access to hand hygiene materials, such as hand sanitizer stations and antimicrobial soap dispensers, as I've mentioned before, which is also very important. At the patient's bedside, at the patient's room, entrance and exit, in convenient and appropriate locations, in high-traffic public areas, such as hallways, elevators, and bathrooms. Healthcare workers also need to make sure equipment are working properly, product fully stocked and used within expiration date. I will add, it's always important if something is not working, such as dispensers, or something needs to be stocked, you need to let your secretary know, your chain or up in chain of command, such as charge nurse, and they can make the accommodations. Why should healthcare workers clean their hands? Well, any healthcare worker, caregiver, or person involved in patient care needs to be concerned about proper hand hygiene. Therefore, hand hygiene concerns everyone involved at all times, regardless if you are a patient or a healthcare worker. Healthcare workers must perform hand hygiene to protect the patient against harmful germs carried on your hands or present on his or her own skin. Protect yourself, the healthcare worker, and the healthcare environment from harmful germs. Major recommendations, standard principles of hand hygiene. Everyone involved in providing care should be educated and trained on the standard principles of infection and control and hand decontamination. Wherever care is delivered, healthcare workers must have available appropriate supplies of materials for proper hand decontamination, as I mentioned prior. Educate patients and caretakers about the correct techniques and benefits of effective hand decontamination. When to appropriately use microbial soap versus hand sanitizer and the availability of hand decontamination facilities. Also, and last, their role in maintaining standards of healthcare workers' hand decontamination. Indications for hand hygiene. When hands are visibly dirty, contaminated, or soiled, wash with an non-antimicrobial or antimicrobial soap and water. Adequate hand washing with soap and water requires at least 40 to 60 seconds, so be sure that you do that, and not just for 5 or 10 seconds. Average time usually adopted by healthcare workers is less than 10%. If hands are visibly clean, use an alcohol-based hand rub or sanitizer for routinely decontaminating hands following visible exposure to body fluids. Alcohol-based hand rubbing should be approximately at least 20 to 30 seconds. Again, most healthcare workers do not average that time. The 5 moments for hand hygiene approach. This is advertised from the World Health Organization. Number 1, before touching a patient. 2, before clean aseptic procedure. 3, after body fluid exposure risk. 4, after touching a patient. And 5, after touching patient surroundings. The end. That concludes my presentation on proper hand hygiene and HAIs, as I hope this was informative and beneficial to you all. I will be issuing you, everyone, a routine post-test quiz that is a combination of true and false, multiple choice, and fill in the blanks, which will cover all the material that was just presented to you. I will provide everyone with an answer key so you can check your answers. Please be safe, use proper hand hygiene, and I wish you a good day. Thank you.